In this video, I'm going to teach you how to perform passive range of motion for the ankle and foot complex. We're going to go through 4 particular movements. One is dorsiflexion, one is plantar flexion, one is inversion, and one is eversion. My patient has already gone through the active range, and now I'm going to perform the test passively because it tests the integration of the ligaments and the joints and the joint capsules, okay? Whereas active range will test all of it, but it doesn't really tell you that much, whereas passive tells me a bit more information. When I do this, I use what they call my trigger finger. So I call this my trigger finger. First technique I'm going to demonstrate is to test passive inversion. So I'm going to place my hand above the lateral malleolus here, stabilize the tibia and fibula, finger below the malleolus like a trigger finger, thumb over the top. And then from here, I'm going to slowly passively invert the foot. And then if my patient says it is painful or I find we have increased range of motion, then it might well be that we have stretch, tearing to the ATFL, which is called the anterior talofibular ligament. If you've got pain slightly inferior here, then it might be to the calcaneofibular ligament. And if the pain is more at the back, then it might well be to the posterior talofibular ligament. But most of the time, this is an inversion sprain type of technique. So when we are doing that movement, it's like mimicking the twisting of the ankle, okay, as in a typical ankle inversion sprain. And roughly 5,000 to 10,000 people go over on their ankle every day in the UK. Now, the next one we're going to do is passive eversion. So similar sort of position, hand under, finger on the medial malleolus, and I'm going to passively evert. Now you can see the structures on the inside being tested, but you can see on this foot. If I lift that up from here, so for instance, on this area here, then we've got something called the deltoid ligament. And actually it's split into 4 different fibers. So we've got an anterior fiber which goes from the medial malleolus to the talus in here. Okay, so that's known as like the tibio-talar ligament. And then we've got fibers coming down, which comes down to the sustentaculum tali, which is located on this sort of ridge just here. And it's of the calcaneus. So you've got fibers coming down. We've got another set of fibers that goes back onto the talus and along here. And then there's also fibers that go onto the navicular. And we've got these fibers at the back, which are called the posterior. So you've got the anterior fibers, the posterior fibers, the middle fibers, and fibers coming down towards the navicular. So it's sort of like 4 sets of fibers to that deltoid ligament. And I test that by slowly everting. I can also change angles and come down this way. And I can also test the posterior one by changing angle to do that way. Let's place that back. Remember, we're also testing to a point some of the tendons. So when I go into inversion, I'm testing more the peronei. Yeah, the brevis comes down to the 5th metatarsal, and then the longest comes around and it goes on to the 1st. On this side here, we've got the tendons that we call the Tom, Dick and Harry, the T, which stands for tibialis posterior, the D, which is the flexor digitorum longus, and then we've got the H, which is the flexor hallucis longus, which come down by the tarsal tunnels along here. If I passively plantar flex, then no doubt the anterior capsule is going to be stretched along here. We're also compressing a little bit on the posterior structure, and we will be stretching a little bit of the tib anterior and the long extensors of the great toe, and also the smaller toes here. So that's called the EHL, extensor hallucis longus, and these are called the extensor digitorum longus. And if I passively dorsiflex along here, so I normally apply a little bit of overpressure because it compresses the anterior joint line. So any form of impingements, you might pick it up, yeah, along there. So I'm going to passively do that movement, but also it's going to be stretching the posterior structures of the Achilles, which is part of the gastrocnemius and the soleus. So what we've done 4 movements where I focus initially on passive inversion, and then I did passive eversion, passive plantar flexion, and passive dorsiflexion. And that would be passive tests for the ankle and foot complex.